Good afternoon, everybody. Welcome back. I hope you're safe, vaccinated, and well, of course, beating the Omicron variant. It has been a turbulent 2 years to everyone, to say the least. Just when we believed that we were out of the woods, the Delta and Omicron variant caught us off guard. And now the big question is there light at the end of the tunnel, or is it a bit too premature to let our guard down? With that being said, I hope that we could potentially find out and maybe even answer that question, given I have the distinct honor and privilege of interviewing Ms. Jeneczka Roman, the Advocacy and Coalition Manager of the Massachusetts Public Health Association. Welcome, Ms. Roman, and could you please provide a brief introduction about yourself?
Definitely. Thank you, Ari. As you mentioned, I'm with the Massachusetts Public Health Association, MPHA, and we are a small, but we like to say mighty, nonprofit policy advocacy organization that works to advance health equity across the state by promoting policies that address root causes of health and well-being. So our current streams of work really focus around housing stabilization, transportation justice, equitable public health services, vaccine equity, and a little bit of everything in between.
Alrighty. And on your website, I saw that you describe your organization as one that promotes a healthy Massachusetts through advocacy, like you just mentioned, communication, community organization, and coalition building. Could you please briefly expand on what you're describing and just go a bit more into that, please?
Yeah, definitely. So our organization really works to build partnerships with local partners that work on a variety of cross-cutting issues. And across all streams of our work, we aim to address historical and contemporary imbalances of power, because we recognize that in all of our current systems, power is really consolidated in the hands of few and effectively maintaining and perpetuating inequity. So marginalized residents, particularly those who have been struggling with and against decades of structural racism, have little access to power to shape policies that directly impact their health and the health of their communities. So while we've worked to advance concrete policy changes, and that's really important to us, what's more important to us is for us to support a shift and who has power to identify problems, identify solutions, and who has the power to drive that change. So to counter this imbalance of power, we seek to support, groups that are grassroots, or organizations that are led by or accountable to people of color, low-income communities, and other impacted groups. So we work to build relationships with those partners, community-based organizations, community leaders, grassroots, healthcare allies, social service, civil rights, and everything in between to identify issues that are deeply felt, develop solutions, and support or lead policy campaigns to address those issues.
Okay. So yeah, I was actually just about to ask how social justice factors into this, but I think you just touched upon it, and how the people who you're helping are all of different races, ethnicities, and socioeconomic statuses, of course. And in that case, then one thing I was curious about is, who do you decide what other organizations that you partner with? Because of course we know the people who you're trying to help, but I guess how do you get the job done in that case, for lack of a better word?
Yeah, I think in this line of work, building partnerships and building trust with organizations that, working on the ground or grass tops organizations is really important. And to advance this work, we have created a health equity policy framework that helps guide all of our work. So this allows us a framework to really, analyze new partnerships, new policies, and that guides us in pursuing all of the work to dismantle structural racism, eliminate poverty, and to center equity in all policies. So that really is our guiding light, and how we determine who and what issues to work on.
Okay. And then of course, time for the big related COVID question. How exactly has the pandemic changed the course of this organization and changed what you normally do from what you might have been used to doing a couple of years ago?
Yeah, definitely. So at the start of the pandemic, our organization convened a cross-sector coalition called the Task Force on Coronavirus and Equity to advance policies to create a more equitable COVID response. And through that, we have worked to, so sorry, I'm so sorry, Ari, my internet is saying that I'm unstable. Am I coming in clearly?
Yeah, you seem to be coming in clearly for me. Yeah, don't worry.
All right, sorry.
No, don't worry.
I'm sorry to to have to stop between that question.
No, it's perfectly okay. Just because I'd rather, of course, you do that than like the internet cuts out and then
If it keeps going, I might need to move. Like the internet here can be a little bit spotty.
Sure.
But let me know if I start cutting in and out. But yeah, I apologize for having to stop.
Don't even worry. Don't worry about it at all.
So I guess I'll just take that question from the top.
Yeah, sure. So yeah, I just asked about how the pandemic sort of changed the course of your organization.
Yeah. So the pandemic. So at the start of the pandemic, our organization convened a cross-sector group of organizations to advance equity in the state's COVID response. And that coalition was called the Task Force on Coronavirus and Equity. And through that, we've been able to really hold the administration accountable to and center equity and elevate equity and center that in all of the COVID pandemic-related policies.
Hi, everybody. Welcome back. I'm sorry, due to some technical difficulties, we had to cut, but I'm glad that we're back and we can jump right back into the questions. So I believe the last question that I asked was how the pandemic had changed the course of your organization.
Yeah, thank you, Ari, and I apologize for the technical difficulties. So at the beginning of the pandemic, our organization convened a coalition of cross-sector organizations who were committed to advancing equity. And we stood up the Task Force on Coronavirus and Equity because we understood that COVID was not going to impact everyone equally. We knew that those who were impacted by racism, xenophobia, and other systems of oppression were going to be disproportionately impacted by COVID. So this pandemic really reignited our commitment to being disruptors and being truth tellers about the cost of institutional and structural racism on health of individuals and of our communities, and really made us more bold in that resolve and in taking action and in our messaging.
Okay, yeah, that's great, and I mean it's good to hear about how while there's so many ways that the pandemic can of course bring you down, and I mean, it's the pandemic, right? It's brought sort of everyone down in a sense. Spinning it so that it's like learning from your mistakes and stuff. So spinning it to see how the things that are supposed to weigh on you and make your life harder can actually make you stronger in the long run is a very good way that we can all approach the pandemic. So I'm glad that you mentioned that. In that case, more pandemic specific question, how have you specifically advocated for things like pandemic related issues, of course, like vaccines and mask mandates and stuff like that?
Yeah, definitely. So our organization has advocated for equity being centered in the state's COVID response and in the rollout of vaccines through the Task Force on Coronavirus and Equity, which was stood up at the beginning of the pandemic. And worked on a myriad of issues at the state level to the creation of our Vaccine Equity Coalition, which is a coalition comprised of racial justice, civil rights, social service, grassroots, and elected officials, all working to center equity and advance equity right in the state's rollout of vaccines. So that is how we've been advocating primarily over the past several months and 2 years around issues relating to vaccination. But through that coalition, we've really advocated for high quality data reporting and collection, and for the state to release that data in a way that can be disaggregated, age adjusted, for all demographic factors, for hospitalization, death, and case rates, because we know that when we look at data at the aggregate level, it masks inequities. So in order to tailor all of our responses, we need to be looking at the highest quality data and be able to disaggregate so we can target resources, materials, and funds to communities that have been hardest impacted, and really center their experience to ground and drive the work.
Right, right. So in that case, I do know that you just briefly talked about how the social justice issues and how exactly that you're handling them in spite of the pandemic and stuff like that. But I was curious if the pandemic itself had brought more social justice issues. Actually, I know you touched upon it with like the vaccines and stuff like that, but do they ever do race or anything like that ever play a factor in this situation or?
Yeah, so I think that the pandemic exposed and deepened existing racial inequities, both in Massachusetts and in the state, and primarily in the context of like vaccinations, right? There have been a myriad of state and federal pandemic response policies, which were race neutral on the face, right? But really had predictable and devastating impacts, which reinforced and exacerbated racial inequity. So, for example, when the general public became eligible for vaccination, Massachusetts moved toward a mass vaccination strategy, so at mass vac sites. And a lot of these sites were long distances from communities where residents of color reside. They were difficult to access without a car or internet access. And there was little interpretation for those who are not English speaking. And did nothing really to address the earned mistrust of residents of color and in their experience and their relation to the medical system. So all of these really exacerbated the racial inequities in the impact of COVID in communities of color.
Okay. So I guess in that case, besides that, then although you've touched upon a lot of them, what other things would you say are the biggest challenges that you might have been facing during this pandemic and that your organization as a whole probably faced?
Yeah, I would say another challenge that our state is facing is we have a really decentralized public health system. So we have one of the most fragmented public health systems in the country. We have 351 local boards of health or health departments. So that's one for every single city and town in Massachusetts.
Right.
And this decentralized approach has created deep inequities across the state. And because we know that COVID and other diseases don't respect municipal boundaries,
Yeah.
right? Like this creates inequities. So if small rural town or gateway cities might not have the same resources to invest in public health services as other wealthier departments. So our organization has been really focused and leading the charge to advance and improve our local public health system by creating public health standards, workforce credentialing, and creating uniform data systems and reporting so that we can measure how we're doing and be accountable to be accountable and set metrics so that we know how we're improving in areas that might need more support so that we can serve all residents and ensure that every single resident of Massachusetts has access to effective, efficient, and equitable public health protections.
That's great to hear. And I guess in that case, what I'm curious about is, and it's something that I'm curious about for all organizations, and I also know I'd like to say in advance that's a really hard question to answer because obviously with the pandemic, things are super unpredictable, but what do you suspect might be like the future of your organization in terms of what goals are you looking to do next? If say the pandemic were to significantly get better, how would you go about, I guess, using that benefit to accomplish more of your goals? Or if it were to go worse, knock on wood, how would you plan to mitigate that and like work around that to still accomplish these goals?
All right, that's a tough question. I would say, we want to be working with our partners to learn to take stock of everything that we've learned from the pandemic so that we don't repeat the mistakes of the past. So this pandemic really has shown us the gaps and the inequities in our local public health system. So as we go forward, we want to make sure that we are strengthening our local public health system, that we're supporting our public health workforce so that we are in a better position should there be another wave, should there be another pandemic down the line. We want to make sure that we're prepared. And then thinking about our vaccine equity work, we want to be able to translate all of our policies and advocacy around, centering equity to ensure that those who have been most impacted have a seat at the table to influence and shape policies and strategies and responses in their communities.
Alrighty. Thank you so much for explaining that. Just because, it's one thing that it's important that we learn from the pandemic and the mistakes that we've made and the benefits and the things that we've done right and wrong so that we can grow from them. And I guess thank you in general then. Thank you so much, Ms. Roman, for shedding light on so many salient points. And it was extremely informative and educational. I do hope that people get as much out of this interview as I did, just an insider look as to what your organization does and how it's battled, especially with things like the pandemic. So once again, thank you, and I hope you have a great rest of your day, potentially shoveling due to the snowstorm that we're stuck in. But yeah, thank you.
Thank you so much, Ari.
Of course.